regardless of age or ability, will enjoy a meaningful life that is led with dignity and self-determination. Our mission is to ensure the provision of effective supports and services to meet the individual needs of individuals and families, helping them to have independent lives and lead lives that are meaningful to them, and also have a dignified life. The philosophy ADSD seeks to understand and respond to the individual, to their needs using the principles of accessibility. So ensuring that they have access to services and supports, accountability, also for holding everyone involved accountable, and services are culturally and linguistically appropriate for that individual or family, ensuring that we have ethics in place in how our services are delivered, that there is mutual respect amongst everyone, that services are provided timely, and that there is also transparency in our service system. And so our programs, so our broad programs within ADSD include protection and advocacy. We have services specific for physical disability. We also have children's services and developmental services. So part of our protection and advocacy services includes our long-term care ombudsman. And this is a program where our specialists advocate for residents that are in nursing homes, residential facilities for groups, and homes for individual residential care facilities, community-based arrangements, and also individuals who attend adult day health care. And so part of their role is to educate long-term care providers about residents' rights, and also about elder abuse, and engage in initiatives that promote quality of life and care for individuals who reside in long-term care facilities. Then we also have adult protective services. And so this used to be elder protective services, and then last year it got put into law. No, last year, no, to cover individuals from 18 through also 65. It used to be elder protective services only provided services for 65 and older, and nationally there was recognition that we had a gap for vulnerable adults 18 and over. So our adult protective services receives and investigates reports of abuse, neglect, exploitation, and self-neglect for vulnerable adults. They provide social service referrals to our community for evaluations for mental health capacity, referrals for emergency placement, referrals for emergency funds for food, rent, utilities, and personal care, those types of things as they get those reports. So there's a numbers there to call to report suspected abuse for Clark County, and then the other areas that are outside of Las Vegas, Clark County. So we in ADSD operate 3 home and community-based waivers, and one of those is for our frail and elderly. And so this is to provide services to our seniors who are living at home or in the community, to help keep them at home and to avoid placement in a long-term care facility. So to qualify for this, individuals must be 65 years or older. And the key to this one is they have to have adequate adequate support in place for when those waiver services are not provided, to ensure that their physical needs are being met, their basic care needs are being met, and those types of things. They also have to meet what we call a level of care requirement for a nursing facility, and then require at least one waiver service ongoing each month. And so those services include case management, homemaker services, and those are services that provide light housekeeping, laundry, some grocery shopping. And then it also includes chore services, and so that's different from homemaker, and that's intermittent, and typically includes helping complete a task that, if it's left unattended, could pose a safety risk for the individual. Respite for individuals, for their caregivers. It also includes a personal emergency response system. So that's a device that's connected to their phone that in the event of emergency will connect them to emergency responders that will know right where they are. And adult daycare, so a place to spend the day, up to like 4 hours at least in the day for so some supervision and activities and adult companion services, and those would be non-medical in nature, so that would include just some socialization and supervision for the senior. And then we have our home and community-based waiver for persons who have a physical disability. And again, this is to provide services to the individual in their home and community and avoid placement in a hospital or a nursing facility. And so to qualify for this waiver, individuals have to be certified by a physician as having a physical disability that results from an anatomical or physiological abnormality. Individuals must meet a level of care for admission into a nursing facility, and also do require that there be a financial eligibility determination through the Division of Welfare and Supportive Services. So services for our this waiver includes case management, so homemaker services, so similar, it's the same as the other, light housekeeping, assisted living, attendant care, so this is where somebody would come in and provide some personal care services to the person, where they may need help with bathing and dressing, eating, those types of things. Include service to their home and access to specialized medical equipment and supplies. And then children's services. And so in our children's services, we have our early intervention services. And this is a service that's provided to infants and toddlers from birth to age 3. They age out at 3. That have a developmental delay or disability. And at the home to help meet the individualized needs of the child, to meet their developmental and learning needs. And so with early intervention, children and families receive specialized instruction from a licensed or certified developmental specialist, because this is a very unique and specialized population to work with. So the staff working with them have to be skilled and trained and to work with infants and toddlers. It also includes children can receive speech therapy, and occupational therapy. As And that program, hello?
Yes, sorry, this is Catherine. We just had one quick question in the chat. One of the students would like to know, does blindness count as a physical disability?
I'm sorry. Yes, it would.
Great, thank you.
Yeah, sorry, I can't see the chat because my full screen is up with the PowerPoint.
That's okay. If you don't mind, I'll pause intermittently if someone has a question.
Yeah, please ask. You don't have to wait until the end. If anybody has questions, just please let me know. So our Autism Treatment Assistance Program provides temporary assistance and funding to help parents pay for evidence-based treatment that's specific for autism services. They have various plan types designed to address the child's individual needs. And so those plan types include a comprehensive plan, and insurance assistance where they can help provide co-pays. They have a basic service, a plan that includes an extensive as well as a targeted therapeutic. So that would be your like speech therapy, maybe your occupational therapy, social skills, and then transitional services to transition from receiving the treatment, the autism treatment assistance. And then we have developmental services. And so we have regional centers throughout the state that provides services and supports to people of all ages that have an intellectual or developmental disability. And that includes assessment and monitoring, referral and linkage to requested services, utilizing a person-centered planning process that ensures that the goal of self-sufficiency, that the person is included in the community, and that they lead a life that is meaningful to them. So services included under developmental services, we have respite that's provided to families who are caring for their individual. Could be a child, it could be adult, as long as they're living at home. We have our family preservation program that provides to families for their child or adult home that has a severe, profound disability. Have our supported living arrangements, and so that can be anywhere from providing intermittent supports to the individual living at home, to living in an apartment where it's coming in weekly to assist with whatever they may need, to also providing a 24-hour supported living arrangement where they're living in a home with other individuals and that there's shift staff coming in to provide supports. Then we have our jobs and day training programs, and so that includes day habilitation services where the person goes to a center and does activities that's meaningful for them in the day. That could also include going and to do outings within the community. Also pre-vocational services and supported employment services fall under that. We also have a clinical team that provides psychological and behavioral assessments and intervention to individuals and their teams. We have nurses that can do nursing assessments and consultations for individuals who have medical needs. We can also contract to provide nutritional counseling as well. And then we have our quality assurance oversight for our providers within developmental services. And then also we have our home and community-based waiver for individuals with intellectual disabilities. So service, yes?
One of the students has questions about wait lists. for the programs that you have just been discussing. Do you have any information on wait lists, and if so, how long are they?
So it's, I don't, wait list for like what particularly?
Well, she's asking about the programs that you were just discussing. So I'm guessing that that she's talking about everything as far as respite, the family preservation program, supported living arrangements, the whole 9 yards.
Okay, there may be wait lists. I'm not sure offhand under what's involved, what we have for each specific program. I know that they try to provide, the regional centers try to provide services, you know, as quickly as possible, you know, based on available funding, that type of thing. So,
are we able to possibly follow up via email and get some information on the wait lists, and I can send it out to the class?
Yeah, so yeah.
I don't want to put it on the spot. I know that that question's kind of hard to answer sometimes, so if maybe we can follow up via email and send it out.
Yeah, let me do that.
Great,
yeah.
Thank you.
Sure. Okay, so service coordination within aging and disability services. So service coordination is also known as case management. The terms are often used interchangeably. Targeted case management is a service that is funded through Nevada Medicaid for specific eligible populations or target groups. That's why it's called targeted case. ADSD provides service coordination across the division, regardless of funding as a targeted case management service. So all of those services that I had discussed for seniors, for individuals who have physical disabilities, developmental services, or early intervention, or autism treatment assistance, all of those programs will receive service coordination or case management. So what is service coordination and case management? Well, these are services that assist an individual or family in accessing needed services and support. So that could include medical, social, educational, housing, maybe transportation. So it links individuals to community resources and information and services. When we talk about targeted case management, that includes 4 specific areas. So the first one is assessment to determine what the needs are for an individual or family. And then based off of that assessment, a person-centered or family-centered plan is developed that identifies the goals for the individual or the family, because when we talk about you know, like our early intervention services, that's all family-centered planning for the whole family. And so goals are identified and have, you know, outline the steps that it's going to take to help achieve those goals, and the person or the family is actively involved in identifying the goals that are important to them. It also includes referral and what we call related activities. So making those referrals to services in the community. And then we have our monitoring and follow-up. So that's where the service coordinator is going to, you know, provide oversight, checking in on a regular basis with the individual and family, and determining progress towards goals, and if the plan needs to be, their person-centered or family-centered plan needs to be updated, you know, based on progress or other events that may be going on in the person's or family's life. And so service coordination, So they're out what people can and cannot do. And they're not determining what the needs are for the individual. The role really of the service coordinator is to be a facilitator and to be the expert on what resources and information is available and provide that linkage to services and supports that are going to be helpful and meaningful for the individual and the family. So, questions?
I'm going to go ahead and unmute everyone. Might take a second for all of them to catch up to that. If you guys want to unmute your phones as well, and if you have any questions.
I have a question about the developmental specialist. Can you explain more about that?
So the developmental specialist for early intervention, or we also, our service coordinators and developmental services are also called developmental specialists, but they play a different role as a service coordinator. So was your question specific to early intervention?
Yeah.
Okay. Yeah. So a developmental specialist in early intervention has to have either licensed through the Department of Education, really as a teacher for early childhood, or they can they still have to have the coursework specific for early childhood through the university. They can also receive what we call an alternative certification through the Part C office that provides the oversight of services to the family and the child, and helps teach the parents what how to incorporate in family's daily routine, and recognizes that the family plays a vital role in improving the child's development. Does that help answer your question?
Yeah. How would they know if, so for example, if the family is okay and doesn't need any more services, how would the...
So they do regular assessments of the child's development. So there are tools or tests that are specific for infants and toddlers that the developmental specialist will do to see where the child is in relation to their progress to their age developmentally. So they look at all areas of development and will make a determination with the family as to whether or not the child continues to need services.
Okay. Does this affect, like, if it's foster parents or what?
Oh yeah, no.
Foster parents and
the services are provided to foster parents as well. So wherever the child is, if they're in their family home or foster care setting, then the services are provided where that child is. So the developmental specialist will go where they are.
Okay.
You're welcome.
Okay, we also have a chat question. One of our students would like to know if a person with disabilities needs to be a U.S. citizen to receive services.
If a person has to be a U.S. citizen to receive services?
Correct.
Huh. I don't think so.
Great. Well, I will include that in the email about waitlists so we can verify and check on that as well. Because I hate to put you on the spot. I know that's also a detailed question.
Yeah, no, and I want to say no. Now, they may not get, so Yes, hold on, I can't answer this. So they can have access to service coordination for linking to community resources and that type of thing, but when it comes to qualifying for like a waiver service or some of our other programs that they typically will, they will not be able to have access to those services. But I will double check that for you and get back to you on the email regarding wait lists.
Perfect. Thank you.
You're welcome.
Does anybody else have questions for Megan?
I just wanted to say hi, Megan.
Hi. Oh, hey, Sarah, how are you? Should I stop sharing my screen? Do you guys need my, here's my contact information. I'll put that up so you all can see that.
I will also include Megan's contact information in the follow-up email as well, so that you guys have that information as well.
Yeah, and if anybody has any questions or if you think about things like later on, please feel free to reach out to me directly. I'm happy to help answer those questions or direct you to somebody who will be able to assist.
We also have another chat question. Do the services available vary between the rural and the urban areas?
So the services are going to be the same regardless of where we are, wherever a person is statewide. The issue sometimes with rural is that there's kind of limited providers to provide those services, but no, those services are available statewide.
Great. I'm enjoying this conversation. Does anybody else have questions? Chat, you can send them in the chat as well.
Can I stop sharing my screen or do you still need that up?
Oh, you can absolutely stop sharing your screen. Everyone, please remember I'll send it in the follow-up too. Great.
Okay.
Great, Megan. Thank you so much for your time as well. I hope you're staying safe out there in all of this craziness. And we appreciate you coming and presenting today.
Yeah, I'm happy to. So like I said, please feel free to reach out if you have any other questions or things come up people think of.
Wonderful. Thank you, Megan. And I will be following up with you. Everyone have a safe and happy week.
Great. Thanks so much. Have a great day. All right. Bye.